little cells that can be cancerous, like the squamous cells that are really cells on the surface of, our skins and perhaps other organ. And we see also where there's a neuroendocrine cancer. And the neuroendocrine cells are really cells that operate like nerve cells. But we see that just on very few occasions, that these result in colorectal cancer. The different types of cancer reflect the variety of cells turning cancerous and their location. Adenocarcinomas are formed in the mucous cells of the rectum or colon. Gastrointestinal tumors or cancers, as we are talking about, can be lymphomas. They start in the lymph nodes, or colon. The carcinoids form in the intestines or hormone-making cells. And there are another set called the sarcomas, which start in the soft tissue, including the colon muscle. Another set is the gastrointestinal stromal tumors, and these can progress from benign to cancerous in the digestive tract. Okay, so here, this PowerPoint, we are going to be talking about carcinoids, and carcinoids refer to slow-growing tumors that can grow in several places throughout the body. A carcinoid tumor often begins in the stomach, the appendix, the small intestines, the colon, the rectum, or the lungs. Symptoms often do not appear until late in the disease and are usually vague. Symptoms include diarrhea, skin flushing, and skin flushing is a phenomenon where the face becomes very hot, and also across the chest. There might also be pain in the abdomen or chest, bowel obstruction, nausea, or vomiting. So these are some of the signs of cancer, as carcinoids, as we are referring to them as here. This slide speaks about the prevalence and the statistics. In Florida, cancer became one of the leading causes of mortality by 2015. Rates linked to the state's large population of 65 years and older and above. Colorectal, breast, prostate, and lung cancer accounts for a majority of deaths by cancer. The burden follows a unique pattern among racial, ethnic minority. It is said that before 2015, heart disease was the primary cause of death among Floridians. The trend was particularly noticeable in Miami-Dade County. The Miami Hispanics and Blacks have significantly higher likelihood of developing late-stage disease for various cancer sites compared to whites. This goes back to culture, as Blacks and Hispanics are steeped in their traditional way of eating. Fried food and processed food form a great part of the diet. There is also the lack of ingesting enough fiber in the diet. Fast foods in America, in the American diet, consist mainly of flour and other staples that have a rich carbohydrate contents. Okay. My next slide is entitled Healthy People 2020. U.S. Department of Health and Human Services, HHS, operates a project, Healthy People Project, to act as a watchdog on matters of health Healthy People is the federal government's agenda for building a healthier nation. This project includes statements of national health objectives designed to identify the most significant threats to health and to establish national goals to reduce these threats. There are several areas that are targeted primarily because of the rise in these health problems. Okay, some of the objectives of Healthy People 2020. One here, we see to identify significant preventable health threats, to reduce the threats, to create a society of healthy and long-living people. Some of the goals I will list here is to attain high quality and longer lives devoid of avoidable disabilities, injuries, diseases, and death, to attain health equity, to improve health across all groups, to eliminate disparities, to create supportive physical and social environment. So these are the goals, or some of the goals, of Healthy People 2020. They want all of us to be able to access health service. They provide information on immunization and infectious disease, about substance abuse, on mental health and mental disorders, and are concerned about the welfare of older adults and adolescents' health. Okay. My next slide here is about Sylvester Salone is a comprehensive cancer center, and it is part of the University of Miami Health Center. It is the only university-affiliated cancer center in South Florida. It's a groundbreaker in compassionate care and cancer treatment, funded by the National Cancer Institute. It serves the South Florida community and US in general. The University of Miami Sylvester Comprehensive Center enjoys nationwide and international recognition for groundbreaking compassionate cancer treatment. Sylvester Comprehensive Cancer Center concentrates wholly on cancer patient care. All different types of cancer are treated there. Sylvester, as it is sometimes called, has sufficient and modern resources and equipment for innovative research and clinical trials. It operates to fulfill the objectives of Healthy People 2020. As a member of staff of Jack's Memorial System, which is a teaching hospital, I know that these two institutions corroborate in providing excellent health care to the community of South Florida and its environs. Mission and vision of the U Sylvester. The mission, one, to reduce human cancer burden through education, research, prevention, and quality patient care. The vision, to become a fully integrated program of education, research, and patient care to achieve international reputation for care excellence, to uphold efficient community responsive care, and to produce resource for enhanced and sustainable innovative cancer programs. Okay, here we talk about the values, and we're still speaking about the Sylvester Comprehensive Cancer Center. The value is excellence, compassion, respect, and discovery. Excellence involves exceeding the target community's limit in expectations and accomplishments. As a compassionate healthcare facility, Sylvester endeavors to care and work for the welfare of others, as well as to alleviate their suffering. Respect encompasses recognition of the community's worth, importance, and quality. Discovery of knowledge and awareness through clinical trials. So that is some of the work of the Sylvester Comprehensive Cancer Center. This center is located at 1475 Northwest 12th Avenue in Miami, Florida, and it shares house with the University of Miami Health Center. Their buildings are connected on Northwest 12th Avenue, and it is accessible from I-95 or State Road 836. The clinic has several locations within 35 miles radius of the Sylvester's main campus, and it operates a 24-hour clinic. So if at all anyone is concerned or wants to go to that clinic, they can go anytime because it operates, or it's operational throughout the day, 24 hours. Services provided. Sylvester is a National Cancer Institute designated center for outstanding laboratory research, patient treatment, service to medically underserved communities, innovative preventive strategies. The expertise is linked with higher quality, longer, and hopeful life. There, some of the services we have, my little chart here is showing us where they offer surgery for cancer. They also offer chemotherapy, and they offer radiation, and they provide clinical trials. It says that colorectal cancer survival at the Sylvester Hospital and Clinic is up to 19% higher than the national average for late and early stage cancers. So they are saying that treatment, or the patients from this center, that they operate or like 19% above per the national average. Treatment, and this treatment is surgery, because one of the options for colon cancer or colorectal cancer is surgery. Most typical form of treatment for the early stage of colon cancer is surgery. It targets the entire tumor and cancer cells in nearby tissues. Segmental resection is another part of surgery, and it is the removal of cancer and normal tissues on either side of the cancer. Surgery is rare in anal cancer because of its location. We know that the anal canal is the end of the colon, and more often than not, that surgery is not used to correct cancer there. They use other methods, perhaps the radiation and the chemotherapy. It says that, okay, that when surgery occurs, a few patients may require colostomy, and I will speak to you later about that. This is just a picture of the surgical team. You know, this kind of surgery is a serious surgery. It is a major surgery. It is not like a simple surgery. So at least they have, you know, 2 physicians and the anesthesiologist and nurses. And they are there. This is just a picture showing, you know, the surgical team. Radiation is another method And we have external beam radiation, most common form of colorectal cancers. And this external beam radiation is used for most common form of rectal cancer. It involves intensity modulated external radiation therapy. This is a special kind of therapy, IMRT. Intensity modulated external radiation therapy. Okay, this is another kind of radiation, internal radiation. And this is ideal for small primary tumors. And it shields radiation doses from sensitive organs. Oncologists at Sylvester Clinic utilizes the most advanced technology in delivering radiation, both internally and externally to the colorectal tumor. IMR delivery reduces treatment time to 1/8 of conventional radiation. So they're saying here that this type of treatment, the MRT, that it reduces treatment time to 1/8 of the conventional radiation treatment, and I suppose it is more effective. This is a picture of a person or a patient receiving radiation. The patient is lying there on the back, and during external radiation, the patient lies on the table, and a machine directs beam of radiation at the cancer. The machine is operated from outside the room, but the patient is watched through a window or a camera. Also, there is intercom communication between, the patient and the staff in case, the patient wants to say something or the staff wants to further communicate with the patient. Chemotherapy is another method of treating this colorectal cancer. And here is just a list of the kind of drugs that are used. Some of these drugs are oral and some are administered intravenously. The systemic medical therapy, that is intravenous, mostly after surgery that is given. Infusion chemotherapy offered at comprehensive treatment center. So the patient would have to go to the treatment center to get the comprehensive treatment. Hyperthermic intraperitoneal chemofusion. It offers higher chemotherapy concentration and reduces side effects. The systemic medical therapy is administered as pills or intravenously, as I said before, by combining a range of cancer-fighting drugs. Sylvester is the first facility in South Florida to offer heated chemotherapy to cancer spreading through abdominal cavities. Hyperthermic intraperitoneal chemoperfusion is where the chemotherapy drug is warmed or heated and is used to fill up the abdominal cavity. That is a new method. Targeted therapy and clinical trials. Targeted therapy attacks cells' molecular alteration. So they attack the cells at the molecular stage and try to break it up and so on. Potentially more effective with fewer side effects. They're saying that this targeted therapy is potentially more effective with fewer side effects. Occasionally, it is combined with chemotherapy. And clinical trials patients access advanced or novel treatment. So when a clinical trial is done for any test, they espouse that the patient access advanced or novel treatment, new treatment. Targeted therapies attack molecular changes that encourage the growth and spread of cancer cells. Before these methods of treatment are used, there has to be several clinical trials to ensure safety and efficacy. The U.S. Food and Drug Administration, FDA, is responsible for protecting the public's health by ensuring the safety and efficacy and security of all drugs used. Okay, so before any of these, before we have a colorectal surgery, we have to perform certain tests to, to rule out if there is, need for surgery and so on. So we have to choose the right test. So there can be a colonoscopy, a flexible sigmoidoscopy, virtual colonoscopy, biopsies, or multi-gene tests. Accurate diagnosis and early detection of colorectal cancer are critical to a successful treatment. Beside the review of the patient's medical history and blood examination, multiple tests are recommended to facilitate cancer diagnosis. Many people are reluctant in seeking out or taking these tests for fear of results. We encourage, especially those who have family history of cancer, to have themselves tested. If there's a common saying that if you don't claim it, you will not receive it, but this is not necessarily so. Okay, so these are some of the people that are recommended. People who have a family history of colorectal cancer, or has a personal history of inflammatory bowel disease. These are the people who should ask their doctor for a colonoscopy. The provider and patient should determine if testing should be started before age 50. Okay, it says, are you age 50 or 75 years? Then yes. The provider and the patient should decide which test is preferred. And I had spoken before about whether you're doing a colonoscopy, a flexible sigmoidoscopy, or virtual colonoscopy biopsy, or multi-gene tests. So you will decide with your doctor which of these tests is appropriate to you. This is a picture of a colonoscopy procedure. And here the patient is draped and is lying on the left side. Colonoscopy is an endoscopic examination of the large bowel and the distal part of the small bowel with a special camera or fiber optic camera on a flexible tube, which is passed through the anus. This can provide a visual diagnosis to see if there are ulceration or polyps. This procedure provides an excellent opportunity for biopsy or removal of suspected colorectal cancer lesions. Here, the patient is placed on the left side and draped and placed under what we call conscious sedation. That is, you're not fully conscious, you're not full under, you're not given a full anesthesia, but you are placed in a position where you are, we say, comfortable, that you don't exactly can feel what is going on, but you can still be given instructions if instructions need to be given. This is a colorectal polyp. Hair is inside the colon, And these are what might be growing inside the colon. It doesn't seem, it is not pleasant to look at, but this is the reality of the situation. These are polyps, and a lot of times they are cancerous. And when the doctor does a colonoscopy, he blows up the colon with something that is called an air compressor, so that he can see, these features. I don't know to call them better, but he can see these growths in the colon, and then he'll be able to burn them off, or what we call cauterize them. And the surgeon can also take specimen from them to see if they are really cancerous. So it is in these examinations during the colonoscopy that the doctor can take biopsy, can remove areas or parts of these polyps to see if they are cancerous. It is recommended that a colonoscopy be done every 5 years in patients under 50 years and every 3 years in people over 50 years. Suspicion lesions may be cauterized, treated with laser light, or cut with an electric wire for purpose of a biopsy. The entire procedure takes about 20 to 30 minutes, depending on the indications and the findings. So if there are more things to be done in there, of course, it is going to take more than the 20 to 30 minutes. Here is just another picture. This is a sigmoidoscopy. The sigmoid, as I had said before, is the distal part of the colon. And sometimes before the doctor does a general colonoscopy, he might just order, or he might just do a sigmoidoscopy. The sigmoidoscopy is a viewing of the lower part of the colon. And it is said that more often, only 5% of these patients are referred to for a full colonoscopy. So sometimes, depending on what the doctor sees here, this part of the colon is so nice and pretty, then he is kind of certain that nothing, cancerous is going on further up. Okay. This is a virtual colonoscopy. In a virtual colonoscopy, this is not an intrusive medical test. What we mean by there is nothing, for instance, the patient is placed in a CT machine, and virtually the doctor will view the colon inside and to see if they are polyps. And if that is so, he will make further decision as to whether he's going to do a total colonoscopy. An MRI is also another method of virtual colonoscopy. But with virtual colonoscopy, there is not much that can be done, just that the inside can be viewed. And if there are polyps of the seen here, the doctor cannot do a biopsy. He will have to resort to the actual colonoscopy, where he's able to take out or to extract the polyps for specimen or biopsy. Before colorectal surgery or colonoscopy can be done, there has to be a prep, a colorectal prep. After the colostomy, if it is found that a tumor or cancerous areas are detected, the patient will be recommended for surgery. Before surgery, the patient must be prepped. The colon must be free of solid matter for a colonoscopy or for surgery. For 1 to 3 days before the patient is required to follow a low fiber diet or a clear liquid diet. Example of clear liquids are apple juice, chicken broth, lemon lime soda, sports drink, or water. It is important for the patient to be kept hydrated. Although we want the patient, to be on a low fiber diet, it is important that the patient be kept hydrated. However, no drinks with dye, like the color red, purple, orange, or brown, should be ingested. The colon must appear in its natural state. The day before the surgery, the patient is given a laxative preparation, such as sodium phosphate or magnesium citrate. And this acts as a laxative to clear the passage of all fecal matter. After this is done, this brings us to the point where there is a need for the colorectal surgery. Here, the patient is draped. The abdominal wall is opened, and the colon is exposed, and the doctor can see and examine what is going on. During this time, it says that the diagram shows the opening of the abdominal wall. The patient is draped, and the area prepared for surgery. Of course, the carcinomic tissues, that are the tissues that have the cancers, are removed, and blood vessels cauterized to prevent excess bleeding. So this is just a picture of, the surgery that is going on there. After the surgery goes on, often when a surgery is done, areas of the sigmoid colon is resected and joined to another area that is free of cancer. An opening is made on the left side of the abdomen, and the colon is brought through that opening, and an apparatus known as colostomy bag or pouch is attached to that opening to collect fetal matter. This is often very scary for patients, as the rectum and anal passage is no longer able to function. The patient must now learn to clean and extract the fecal waste and reattach the pouch, which acts as a reservoir for the waste. So this is this picture here is what I just spoke about, where the colon is resected and all the cancerous parts are taken off as much as possible, and the large intestine is now brought up to the surface of the abdomen. This is the surface of the abdomen. If you look here, you will see that this is the mid part of the abdomen. This is one side and this is one side. And the colon, this red part here, is the colon that is brought up here. And this whole thing is called an ostomy, or an opening. It is here that the patient is going to defecate through. And it is here that what I spoke about, the colostomy bag, and I will show you shortly what that looks like, that a colostomy bag is going to be cemented around here. And the colostomy bag has some little clips, and they will be clipped onto this. The area of skin surrounding the colostomy, that is the area here, is often irritated, as constant applying and removing of the colostomy bag can lead to skin breakdown. However, good hygiene must be practiced and upheld to prevent unpleasant odor, because what is happening here now, here is used as the anal canal, and it is from here that all fecal matter is going to be coming. So this is the colostomy apparatus or bag that I talk about. Here, this part of it, it has some clips underneath. And here is cut to cover that area that I had shown you where the colon came up through here. So we have to measure the size of the colon and to cut this little apparatus so that it fits snugly over the ostomy opening. Then we attach it to this. It has little clips and we attach it to this and then attach it to here. In this picture here, we see that this part of the bag is open, and it is in this bag that all the fecal matter will be collected. And we see here that there are clips. This is one clip, and the clip is used to secure the bottom of this bag so that the feces does not come out. And it is clipped, and when it is time for the person to empty the bag, they often take off this part and flush the content that is in here and replace this clip. So that is what it is about. But like I said before, there are patients who are very scared and who refuse to do this. And in my own experience, I am to teach the patient that this is what you will have to do for yourself. I am not going to be home, or the nurse is not going to be home with you to do this. But a lot of times the patients are scared, and we do understand this because it is a new experience, and it comes with, you know, an amount of fear and anxiety as to what the future is. So I am wrapping up. And here I am summarizing. It says that cancer in any form is a serious illness that can affect anyone. It is often a crisis when it is present in an individual or a family. The good thing is that it can often be prevented by lifestyle practices. Frequent testing is necessary for some cancers. Men over 50 years should speak to their doctor about tests for prostate cancer as well, as colorectal cancer. Women should follow up with their yearly gynecological exams, as well as a daily personal examination of the breast and underarm lymph nodes. Daily examination can detect changes and may lead to early detection and treatment. Men are often afraid to speak to their doctor about prostate cancer. They're afraid of the digital exam, but it is important. Another test that can be done to detect prostate cancer is called the PSA test. It is a prostate specific antigen test. That the doctor does. It is a simple blood test, but if there's cancer there, or in the blood will show a certain perhaps elevation of the prostate specific antigen, and the doctor will go from there. They say if the level are between, say, 4.0 and 10.0, there must be need for further investigation. So I trust, dear ones, that the information was beneficial to you, and may God bless you. So if there are any questions, let me see. if I can answer any of your questions. So, Elder Ken,
Yes, Sister Marie.
what do I do now? Close this?
Well, just keep it open for right now, just in case there are any questions. Anyone, any questions for Sister Marie? Anything regarding colon cancer, colorectal cancer, or anything on the presentation? Sister Raquel?
Yes. Question, Sister Marie.
Yes.
Is there any other recourse besides that bag?
Well, colorectal cancer, like I said before, there are 3 stages of cancer. The first stage, and at this first stage, there might be recourses. At the second stage, there might be where the cancer is gone into the lymph nodes. The third stage, the cancer, are you there? The cancer,
Yes, I'm here.
The cancer metastasize. And there is sometimes little that well, when the cancer metastasizes, in the third stage, it goes to the lymph nodes, and in the fourth stage, it goes to other organs. And like I'd said before, the organ that it mostly goes to is the liver and the brain. And when it is in the liver and the brain, perhaps you have to ask for the prayer of the elders of the church.
And all the brethren too.
And see what comes.
Okay. So you mean still with all their I'm looking at it here, because if you are in the fourth stage, apparently with that bag, your life is over.
Your life is over. And many times people do not find out that they have, this cancer or many other cancers until they are in the fourth stage. A friend of mine who died, she was my boss for a while, and she died 2 years ago of lung cancer. And when they diagnosed her lung cancer, she was already in the fourth stage, and she was showing very little symptoms. She had a hoarse cough, but that was all. And when she was diagnosed, she was in the fourth stage. And there she tried everything she could. She changed the diet. She went to our Seventh-day Adventist sanatorium and all that. But she later succumbed to it.
Was she a smoker?
She was never a smoker. She's a Seventh-day Adventist, born a Seventh-day Adventist. And I know her well. She was never a smoker.
What caused it? Do you know?
What?
What caused the lung cancer? Do you know?
Well, several things. Disease can lead up to lung cancer. Any infection can lead up to cancer. Depends on how the cells react. But another thing that we might remember is that second-hand smoking is just as dangerous as first-hand smoking. We are in a workplace and we are in a surrounding where people smoke and they don't care about you. Mm. And we sometimes innocently suffer the consequence. And I know that was the situation with my girlfriend. She was never a smoker. She was a nurse. Grew up a Seventh-day Adventist Christian. We went to the same church. She was my boss. She was director of nursing where I worked. And she was never a smoker. And just when she was entering like 50, she developed lung cancer, died a few years later. And she was never a smoker. So
somebody near her smoked. Someone she was close to smoked.
I don't even think that's someone she was close to, because like I said, her house doesn't smoke. It's a Seventh-day Adventist home. Her children are young children. Her husband doesn't smoke. Okay. And where we used to work, people smoke there, because in America, everybody has the right to do what they want. So in the workplace, I know that people smoked there, because sometimes as a nurse, we would catch patients smoking, and they were not supposed to smoke inside, but they would do that because they would tell you that they live in America and America is free. So that answers your question.
So so the bag is the only recourse when it's in the advanced stages, but not in the early stages.
Well, the bag, like the bag here, is when, for instance,
Pull up back the picture.
The bag here is when they have when they have done this. In most colorectal cancer, they have to do this. The intestine, the large intestines is brought to the surface of the abdomen because the function of the rectum and the anus or anal canal can no longer be. So no stool can go in the anus or in the rectum. The stool, whatever stool is formed in the large intestine or the colon as we call it, has to be brought out. It cannot go down. So what the doctors do is they put an opening in the middle or the side of the patient and brings up the intestine. And this part here is the intestine. And we see a little opening here, and it is through there that the stool will come out.
Okay. Vernon, are you listening?
Wait. And this colostomy bag is what is attached to that opening there. Is that the colostomy is attached to there, and the stool is gathered, or the stool flows into this bag, and it is not a nice thing.
So the moral of the story is just don't get cancer. Live healthy, eat right, cut out overfried foods, eat fiber-rich diet, a lot of more natural things, more things that grow on trees than things that come from factories. And you reduce significantly your chances of having to carry around a colostomy bag.
Yes, Elder.
Amen.
So that is so. So we have come to the end of our session, and may the Lord bless you and bless all of us, and may we take heed and do the best we can to prevent this kind of thing. Like the elder said, we have to choose the diet or lifestyle.
Go ahead, Sister Marie. Sister Julie has her hand up. Go ahead, Sister Julie.
Sister Marie, I wanted to find out from you, since you mentioned within your presentation about using chemotherapy as a treatment for cancer. I wanted to find out what your thought is in regards to that.
You know, as a Seventh-day Adventist Christian, we don't believe that, this is good, because in chemotherapy, both the good cells as well as the bad cells are destroyed. But it is a way that cancer is treated. But it is not something that I ascribe to, but that is how it is, because chemotherapy destroys both the good cells as well as the bad cells. And there are certain parts of the body that cancer may occur that they might not be able to use surgery to take it off. They might only be able to use, chemotherapy. And in most cases, really, we know it doesn't cure, or it might just prolong the life of the patient, but it does not. For instance, if a person has cancer of the lungs, a person with cancer of the lungs, no surgery can improve that. You cannot cut off a part of the lungs. You cannot cut off a part of the kidney. So those internal organs most times are treated by chemotherapy, So that is the situation.
Okay, and I also had another question in regards to the colonoscopy that you had mentioned. That you said that anyone under 50 should get it every 5 years.
Yes.
Anyone over 50 should get it, should have it done every 3 years. I
Yes.
want to find out what your thought is on colonoscopy.
Well, colonoscopy, Sister Julie, is a good thing. It is a test that will show you if you have or you are inclined to have cancer of the colon. You cannot know if you have cancer of the colon unless there's a colonoscopy. And a colonoscopy is just a way of them looking into your colon with a microscope to see what is going on in there. So it is a test that you should have. To me, as a matter of fact, I have done colonoscopy twice in my life. And my doctor I see recently, who is calling on me again, saying that I need to come and do another colonoscopy. I did a colonoscopy perhaps 4 years ago, and I am going to do a colonoscopy again. Although it is invasive, to me it is necessary. An ounce of prevention is better than a pound of cure.
Okay. All right. Brother Vernon.
Actually, that's where I want to start what Sister Marie just ended on, prevention. I remember years back, I think it was back in the early 90s, at my old church, a doctor, interestingly, his name is Dr. Coffey. He did a presentation on, like, I think it's treating the colon, and it was a long time ago, but it was basically about the colon. And he gave us some things to basically like colonics, colon cleansers, and detox. He talked about ways of getting the things out of getting the backed up matter out of the colon. And I was trying to look up, there's a certain herb that he mentioned. I was trying to remember the name, but I know that there's a lot of good colon cleansers on the market. But yeah, the most important thing is definitely treating the colon. How he brought it out, and a lot of things that he told us. I wish I could demonstrate it, but like certain exercises that we could do to get the fecal matter from out from going through the body. Well, just okay, using a mental picture, he talked about how, like, as a practice, to start from I think he said the left side of your abdomen and roll to the right. Keep this like in a kind of like a counterclockwise or clockwise motion. To release the bowels. And he talked about certain things to make sure that you're being regular all the time. And when you go into the restroom, how to sit on the stool to make sure that you have adequate optimal removal of the bowels. I think I was trying to look it up just now before I came on. It's like a clover or something like that, but it's like a very good herb in cleansing the colon, but definitely prevention, as Sister Marie said. I mean, it was so graphic. I remember when he did a presentation that all of us inside our audience, took it very seriously, because he said, and I remember to this day, he said it, death begins in the colon. So it was very important, how we treat this part of our body. Thank you, Sister Marie, very much.
As Christians, we have to be realistic. We are living in a fallen world, and our bodies are subject to sin. And although we might do the best we can in preparing or in eating properly, our body is still subjected to sin. So to me, to do a colonoscopy or to go and do a gynecological exam or to examine my breasts to see if there are lumps growing, to me, those are things that are important. And while others might think otherwise, you have to make the decision. Each person has to make his own decision and determine what is right for him.
All right. Amen. Any Sister Raquel? Oh, before Sister Raquel, Sister Raquel had asked about the person who Sister Mary mentioned, her friend who didn't smoke and yet who had lung cancer. And yes, in fact, one of the number one causes of lung cancer, apart from smoking, is a gas. It's an invisible gas and it's odorless. You can't smell it. It's called radon. And a lot of people are exposed to radon gas. It occurs sometimes in houses. Sometimes from radon gas, sometimes comes from the soil, like maybe depending on where your house is, it can come up, it can get into your house or whatever. And people who are exposed, in fact, it is said that where non-smokers are concerned, an estimated 12% of lung cancer deaths, both in smokers and non-smokers, 12%. That's about 15 to 22,000 cancer-related deaths per year, annually. They are believed to be related to radon gas exposure, one word or exposure to radon gas. And secondhand smoke, Sister Marie had mentioned that too. That too, you might not smoke, but I mean, you might be smelling, you're somewhere somebody smoke. You know, even if you rent a car, it's good to make sure it's not one, you get one, you go in there, it smells like somebody was smoking in there, it's in the fabric. Tell them, change it. I don't want this one. You know, because asbestos is another thing. In the US, they banned asbestos. It used to be in building materials, like certain things in building materials, certain building material, but they banned it for some years now, because a lot of people used to get cancer from homes, living in homes that were built with materials that had asbestos, but that's been banned. But exposure to that, and sometimes, you know, air pollution. I mean, sometimes people just smelling the wrong thing, it can cause lung cancer. If you're in an environment that you spend a lot of time in, like a work environment or whatever, and just something there is in the air that you're inhaling that is toxic, and sometimes it's not even, sometimes it might be even odorless or almost odorless, you hardly smell. Exposure over time can compromise your lungs and create lung cancer.
We see this too, where people are doing the what is the word? Where you color your car. What is it called again? Paint the car. You do color your car, and that odor. I have a friend. I don't know if he died from.
You're spray paint in the car.
Yes, I have a friend. He was not really my friend, a friend of a friend, and he died from lung cancer, and he spent years doing that. You know, and he died from lung cancer. So as we, Ella can say, we have to be careful, very careful. Sometimes we don't know these things, and, you know, we have to just ask the Lord to protect us. And if he protects us as much as he can, but we have to be careful with our lives and the way we live our lives.
Yeah, one more thing too before Sister Raquel speaks. Even when you're pumping your gas, like I was filling up my gas yesterday or the day before, one of those, I think it was yesterday. And, you know, when you're smelling the gas strong, you know, you can set the pump and you can step away. But it's one of those I have to hold the pump and you're smelling it strong, step on the other side and hold it where the wind is, you know, on the windward side. Because if the wind is blowing one way and you're on the opposite side, it's blowing all that fumes and you're inhaling it there, even 5 minutes or whatever you're pumping the gas, you know, if you've inhaled a lot of toxic fumes that are very damaging to your system. So it's better if you know that, you know, the wind is blowing from the right side, it's coming from your right, then go on the right side of the pump so that it's blowing the fumes away from you as opposed to blowing it towards you. Because a lot of those ways we inhale, even just for a few minutes, a lot of toxic substances that are very harmful to us. Sister?
I don't hear her.
Sister RM, Sister Raquel, you had your hand up? Or was that from before?
I'm sorry, I forgot my question.
Okay, see in a moment. Put up back your hand and remember it.
I'm reading on radon here, yeah. And I forgot my question. Okay.
It will come back, Sister Raquel.
Okay.
It will come back. When I get to your age, I hope I remember things a little bit better.
Okay. So
hold on. Sister Sharni, we have some hands up right here. Sister Sharni's hand is up. Go ahead, and then Sister Delaney. Go ahead, Sister Sharni.
So I wasn't gonna